going to talk a bit about sciatica. That's a really common condition I see in my orthopedic practice. People will come in complaining of pain in their low back that radiates down either their right or left leg. And it always goes down the back of the leg. And if it's true sciatica, it goes all the way to the foot. So what does that mean? What is sciatica? Well, sciatica is when your fourth, fifth, S1, S2, S3 nerve join together to form actually the biggest nerve in your body, which is called your sciatic nerve, which travels through your pelvis and down your leg. And it goes all the way to your foot. And if that nerve gets irritated, whether it's from a disc herniation or arthritis in your spine, that will cause pain that shoots down the back of your leg, past your knee, into your foot. It could also cause numbness and tingling. So I'm just going to go over the anatomy a bit. This is your spine. You have a cervical spine that turns into a thoracic spine, which then goes into your lumbar spine. And this is a blown up version of your lumbar spine. These are your vertebral bodies. This is the disc, which acts as kind of a shock absorber between the bones. And going through the spine is your spinal cord, which you can see that goes through the back of the spine. And then it shoots out these nerve roots, which go down to your legs and your low back and up into your neck, goes into your arms. The nerve roots do. Here's an intervertebral disc or a disc. Again, these blue structures, and then these are the bones. And the disc kind of function as a shock absorber. This is another view looking straight down on your disc. This is your spinal cord. These are the nerve roots that come out through the spinal cord, and they actually live within the spine itself. This image will show you a disc herniation. When you have your disc where part of it tears and the disc material ruptures out, it can push on your nerve root, or it can push on your sciatic nerve, causing pain. And here is the top vision. Here's the disc material. Here's where the annulus of the disc has torn, and you can see that tissue pooching out, pushing on your nerve root. This is a video that gives a little better description of what we're seeing. Vertebral bodies, disc spaces, your spinal cord is going down through here, and nerve roots are coming out. So here's a disc, and you can see how it kind of functions as a shock absorber. Here is another picture of the disc, and you can see where it's beginning to herniate and where the material comes out and pushes on the nerve root. And this is a top view. Again, the disc material comes out and pushes on a nerve root. So sciatica is when you have a disc that herniates, pushes on your sciatic nerve, which is made up of a bunch of different nerves that come out of your lumbar spine. It gets pushed on, and nerves don't like to be touched or pushed on, which is why it creates pain going down your leg and numbness and tingling going down your leg.